Good morning, afternoon, or evening, depending on where you are in the world. My name is Lydia O'Meara, and I am a second-year PhD student at the Natural Resources Institute, University of Greenwich. I would first like to acknowledge my co-authors, Chris Turner from NRI and Denise Cortino in Stinica Aonima of United Nations Nutrition. To date, very few studies have assessed the impact of the pandemic on consumer food behaviours through a food environment lens. To our knowledge, there is only one multi-country food environment study that has been conducted, while the rest have been at subnational or local scales. Therefore, the purpose of our study was to explore the immediate individual level perceptions and experiences of food environments and food acquisition practices across the globe during the early months of the COVID-19 pandemic. For the sake of time, I won't go through all of the elements on this slide. In brief, the development of the survey and the analysis were guided by the Food Environment Conceptual Framework by Turner et al. For this study, we used a rapid assessment online survey of semi-structured and open-ended questions. This was distributed during April 2020, which was the second month of the pandemic. Recruitment was primarily done through UN nutrition networks, forums, and on their social media platforms, such as their website and snowballing methods. This resulted in a convenient sample of 2015 adults. The data was then analysed using qualitative thematic analysis and descriptive statistics. In this world map, the blue shading represents the lockdown stringency index for each country as of the end of April 2020, which was the last day of the survey. At this time, 95% of countries worldwide had deployed strategies to control viral transmission. The orange bubbles, such as here and here, represent the survey respondents and the countries that they reported from. Half, or 52%, of respondents were from low and middle income countries. These were mostly from Latin America, South Asia, Asia Pacific, and Africa. The rest were from Western Europe, North America, and Australia. Although the survey was translated into multiple languages, including Mandarin, there is a notable lack of respondents from China and Western Europe. This graph represents the reported change in food-related behaviours since the onset of the pandemic. As you can see here on the left, the majority of respondents were abiding by stay-at-home orders and were no longer eating out and were shopping less frequently. On the right here, you can see that in this sample, 80% reported a sharp increase in cooking more at home. Although there was an overall increase in fruit and vegetable use, it is worth noting that this was not the case for everyone and that fresh produce consumption actually declined for some individuals. On the left of this graph, you can see that the majority of respondents were exposed to COVID-19 related information and were experiencing physical distancing and restricted access to stores. Not surprisingly, stockpiling food waste, and emotional food behaviour and grocery deliveries were common. More specifically, 63% reported that they were more aware of food waste, and 47% were buying more food due to fear or anxiety. When it came to procuring food, almost equal amounts were ordering groceries delivered from local vendors or large supermarket chains, and a small percentage were growing their own food. If people were looking for support, they were more likely to reach out to friends, family, or neighbours than formal social services or food banks. For the sake of time, I won't read out everything from this table, but in summary, the thematic analysis identified 4 overarching themes, 10 sub-themes, and 4 cross-cutting themes that I will explore in detail in the following slides. For the theme food availability, Respondents described restricted food access due to vendor closures and reduced opening times, which limited their access to preferred foods, such as this example from Italy. Food shortages were described across many settings, with respondents from low and middle income settings noted reduced availability of perishable foods, such as this example from India. Mobility restrictions were reported to have reduced physical access to food in the majority of countries, especially in the countries that had the most severe lockdowns, such as Sri Lanka, India, or the Philippines. And narratives around the home delivery of fresh produce were common, such as this example from Ecuador. However, several respondents described limited delivery options due to lack of services or long waiting times. The elderly and those quarantining at home also had to rely on social networks to deliver food. For the theme prices and affordability, participants reported sharp rises in financial insecurity due to reduced employment opportunities and explained how this had impacted on their ability to purchase food, such as this example in Nigeria. Some respondents reported increased food prices, especially in the relatively volatile markets of Africa and Asia, such as this example from the Philippines. In the relatively stable high-income country markets, respondents attributed increases in food expenditure to paying a premium for convenience, either by buying at more expensive local stores or due to the cost of home delivery, such as this quote from Canada. Regarding food acquisition practices, respondents outlined a series of changes in shopping behaviour. Stockpiling food was reported worldwide. However, many high-income country respondents reported stockpiling in response to panic buying, while low and middle-income country respondents, such as this one from Bangladesh, bought more food for fear that supply chains would fail. Some described changing their choice of vendor type, motivated by a desire to support local vendors and to limit exposure, such as this individual from Guatemala. And narratives around gifting food, such as fresh produce from the home garden or cooked meals between friends, family, and neighbours, were also common, with many participants describing a strong sense of community solidarity. Due to stay-at-home orders, respondents reported more time to cook at home. Also, because they were motivated to reduce shopping frequency and due to heightened awareness of food waste, participants demonstrated a willingness to improve their food literacy and cooking skills, such as these examples from Ireland and Australia. Notably, dietary changes were found to be contrasting among respondents. While some were reportedly eating more poorer quality foods, such as high sugar snacks due to lockdown-induced boredom or anxiety, such as this example from Germany. Others described adopting healthier food patterns due to increased time at home, such as this example from Argentina. This graph outlines 10 policy entry points, represented by the blue hexagons, that we identified that could be used to build more resilient food environments mapped to the external and the personal food environment domains. In both developing and high-income countries, respondents reported common themes around reduced food availability, physical access, and affordability that negatively affected food security. This reinforces the need for policies to 1, monitor food prices, 2, harness the synergistic effect of short and long supply chains, diversify food sources, decentralize markets, while also providing sufficient social safety nets and supporting businesses, especially small and medium-sized producers, to adopt e-commerce. Respondents also reported adaptive behaviours, such as community food participation, social networks, and increased home cooking and heightened awareness of health and food waste that could be leveraged through public health campaigns to improve food literacy and, in turn, public health. In conclusion, evidence indicates that the COVID-19 pandemic has disrupted food environments, threatening global food security. A unique contribution of this study is a qualitative analysis across a diverse range of countries and contexts spanning Western Europe, North America, Latin America, Asia Pacific, and Africa. Results presented here highlight food system vulnerabilities and examples of resilience, which means that synergistic public health nutrition policies are needed to build more resilient food environments and support vulnerable population groups. Also, positive dietary-related behaviour change manifested during this time may be leveraged to promote sustainable, healthy diets. Thanks for listening, and happy to take any questions.